If someone wakes up one day and they find that their face has shifted to one side, or they have one side of their body weak, maybe the an arm and a leg, or they've lost their ability to speak. If it happens suddenly, that's what that's the evidence of a stroke. And what is stroke? A stroke is an accident, is a damage that happens within the brain. And what causes it is that blood to the brain, the supply is limited for any given reason, and that can cause damage to the part of the brain that the blood shortage would have supplied. Because the brain is like a ball of nerves, and that's the center where all our activities actually generate. That's where they are generated. That's the center for all our activities as living beings. Okay, so and the brain is heavily dependent on blood supply. That is, it cannot be healthy for an extended period of time without adequate blood supply. It gets its oxygen from the blood, it gets the glucose that it uses as a form of energy from the blood as well. Okay, so if someone has a stroke, what is most important is that they, with as quickly as possible, they are taken to a hospital where they can get emergency treatment, because the earlier there's intervention, the better the chances that the person can return, to health and be optimal again in terms of their health. Because there's different types of stroke. I won't go into the details, but some of them require some emergency treatment, and that treatment depends on how soon the person gets to the hospital. And then there will be scans of the brain to know the nature of the stroke and the best form of treatment for that kind of stroke, so that the person can have a chance of returning to a good, to a healthy life, optimal life. But more importantly, a stroke should be prevented by having a healthy lifestyle, and not smoking, not abusing alcohol, um, eating healthy things, being active, physically active. Not that one is seated all the time in the office, at home, always on the couch watching things. There must be physical exercise. There must be a balanced diet. So these are a few. And for those who have hypertension, that is high blood pressure that is constant, or high blood sugar, that's diabetes, those people need to be catered for. They need treatment to keep their blood sugar, as far as diabetes is concerned, or their blood pressure, as far as hypertension is concerned, to keep it normal. And then they have a better chance. Then that's the lifestyle required, to prevent and to minimize the chances that anybody will suffer a stroke. I hope this has been educated. My name is Olalekan Kolawole. I'm a doctor. I live in Nigeria. Thank you.